Good evening, everyone, and welcome to our community conversation on healthcare. We want to take the opportunity tonight to talk to you about some of the things that are happening in healthcare across the province and in this community. My name's Nancy McConnell-Maxner. I work with Nova Scotia Health, and I'll be moderating the conversation tonight. I hope that you had a chance to kind of walk around and get some of the information from the tables. And I just wanted to kind of do a quick overview of what the structure for tonight will be. So we'll do a formal welcome in a minute, and we'll have introductions and opening remarks from our leadership team here. And then we'll open it up to the floor for questions. As we get to that, the question part, I will call people one at a time. I always laugh and say it's rude to point, I know, but it's the only way I can figure out how to do it. So I'll point to whoever is going to be asking the question, and I'll ask you to hold your hand up. Someone with a mic will come to you with the mic, and you can ask your questions and have your questions answered. This part of the evening is recorded, is another important message, and that's important for you to be able to watch later if you want, or for people that are not able to make it this evening, they can watch it later when they have time. So I think that those are the two big things. I guess the other final thing before I pass it over to MLA Nolan Young to do opening remarks. I guess before we start the questions, I'll go over that. So I will invite the MLA to come do opening remarks. Thank you. I will say we're not wearing masks up here because you can't hear through the mic. So that's part of we've tried it in other sessions, it doesn't work.
Perfect. Thank you so much. I'll be brief. I just wanted to really thank everybody. We have a great crowd that's here tonight, so thank you for taking time to come out to this healthcare conversations tour. We look forward to the discussions that were coming from the group. So I am going to also, I'm pleased to introduce my colleague, the Minister of Health, Michelle Thompson, Deputy Minister Jeannine Lagassé, as well as interim CEO Karen Oldfield. And they're here with us tonight to provide an update on the work that's currently underway to improve healthcare system, and more importantly, answer your questions, hear your concerns and suggestions regarding ways to improve the system. So with those few words, I'll pass it over to Minister Thompson.
Thank you, Noel, and thank you. Good evening, everyone. It's nice to see such a big crowd here. Before we start, I just want to acknowledge that one of our MLA colleagues is here somewhere, Zach Churchill. We're putting miles on Zach today. He's at the back. He's been to Halifax to an announcement, and we just had an opportunity to spend some time with the folks in Yarmouth, and so I want to acknowledge that Zach is here as well. So thank you for coming out. My name is Michelle Thompson. I am the MLA for Antigonish, new to politics, elected in 2021. I am a registered nurse. I've worked across all parts of the system, long-term care, public health, critical care. Half of my time was spent at the bedside and the other half was spent in leadership positions. And so just prior to being elected, I was the CEO of a long-term care facility for about 6 years. And so I thought I'd throw my hat in the ring and see what would happen, and here I am. So shortly after we formed government, the first thing that we did was change the leadership structure. So it was ever thus that Department of Health would have been the policy and the funder for our healthcare system, and Nova Scotia Health was the operator. And so those two entities ran parallel, and while they worked together, they were not really integrated in the way they are now. So we have a new health leadership team that consists of Deputy Lagassé and CEO Oldfield. And it also includes Janet Davidson, who acts as the administrator. And Janet Davidson is very experienced registered nurse and really considered a thought leader on healthcare and healthcare systems in our country, and I would say internationally. And also includes Dr. Kevin Oldfield, who is an orthopedic surgeon and served as a deputy minister in the past. So it rounds out the team, and of course this core team is supported by a lot of experts in the system to support the decision. And for the first time, we're making decisions across the system. And it's integrated. They meet on a weekly basis. We talk on a daily basis. Sometimes we talk more than we want to. We talk a lot. And so it's been very nice for us to understand the role that the other person plays and how we make decisions. And so I think right within 2 weeks of forming government, the health leadership team and the Premier and I had the good fortune to travel across the province and meet with healthcare workers. We knew that the platform that we ran on around healthcare resonated with Nova Scotians, and we wanted to hear directly from healthcare workers. So we started in Neils Harbor, and then we went all the way to Yarmouth over a 4-day period, and we were able to meet a number of healthcare workers and hear from them directly about what they felt their challenges were and what they felt would help. And as a result of that consultation, we developed Action for Health. And I'm not sure if people are familiar with that. You can Google it. It's the first healthcare plan that we've had in at least a dozen years, probably more, in Nova Scotia. And we not only identify the 6 key areas that we feel are necessary for us to transform, but we also have a website that helps us measure what we're doing, where we have our challenges, and how quickly or how slowly things are moving, because not everything is moving as quickly as we would like. So this is our 18th community conversation, so we're about 16 months, I think, into our mandate. And so we wanted to spend time going into community, talking to Nova Scotians, telling you what we're doing, because sometimes it's hard to get the message to you, and then hear what your concerns are. And very often, we're going to meet in the middle. I think it's been a really great opportunity for us across the province to hear from communities and tell you what we're doing, and also take your ideas, because often solutions lay in the community that needs this support. So very much looking forward to hearing your thoughts and answering your questions tonight, and it really is a conversation. So thank you again, and I'll turn it over to Karen Oldfield.
Yep. Hi everybody. Well, we've had a bit of a day. We started early, as the minister said, and I guess Zach was in the city as well, so we started early, beetled down to Yarmouth and back to Shelburne, so it's nice to be here. And I'd like to start with 2 things. The first thing is, I'd like a show of hands to maybe just a wave of all current and former healthcare workers. Do we have any healthcare workers in the room? Okay, we got a few. Yep. Nice. And it's interesting because we've gone around the province, and we usually have about 20 to 30% of folks in the room that are active or just retired from our system. So lots of knowledge and lots of experience. And it is my pleasure to say thank you. Thank you to each and every one of you. And on behalf of every single person in this room, I really say thank you. It's a very difficult time to be a healthcare worker. And just when you think it's going to get better, it seems to get worse. So, you know, we have heard similar themes around the province. We've heard a lot about recruitment and retention. We've heard about EHS. We've heard about access. We've heard about ER wait times. We've got lots of things that we can share, but hopefully it will be a two-way street tonight. And to start, I'd like our Western Zone team, our leadership team, to join us here at the front and just tell you a little bit, just a little focus on Shelburne, a little focus on Roseway, tell you what's going on here. So we have our VP Operations, Tanya Nixon, we have Dr. Cheryl Pugh, and we have Allison, and is that Jody I see back there? There she is. Hey, Jody. Jody. And perhaps you could just open it up, Tanya, and tell folks what's going on here.
Yeah, sure. Good evening, everyone. Thank you so much for coming. It is our pleasure to be here tonight to listen and to learn from you. As our colleagues here tonight have said, we've really spent much of the last year listening to learn from communities, from staff and providers. We started out listening and learning from healthcare providers. We've spent time visiting and talking to communities about emergency room closures. We've spoken to members of your community about your emergency room closures, and we're here tonight with you. We were in Yarmouth earlier and been in other locations in the zones. You're going to hear me and my colleagues tonight, our colleagues here, talk about staff stabilization, the importance of recruitment and retention of all providers. Really important that we continue to work hard together with communities to recruit, and more important for us to focus on retention. We certainly can't lose any more healthcare providers from the system. In this particular community, I'm incredibly proud to say, in partnership with Penny Smith, who's here, hi Penny, and MLA Nolan, and I saw Norm from the foundation here. Many of your community representatives sit with us regularly on a community stakeholder committee where we talk about important health issues that exist within your municipal units, and we work together to solve those issues. We also advocate and make recommendations to the system, so we hope you'll hear about some of that work. We value those partnerships significantly, and we look forward to continuing to sit at that table. I'd like to introduce my colleague, Dr. Cheryl Pugh. We work together in the zone. Cheryl?
Good evening. Can you hear me? I'll try your mic. Yeah. Can you hear me now? Okay. Good evening. Thank you for coming. My name is Cheryl Pugh. I am an obstetrician gynecologist. I work clinically in Bridgewater. My role with Nova Scotia Health is medical executive director. So basically, I bring the physician lens to leadership. We have physician leaders throughout the entire zone, 3 regionals and all of our community sites. And we are partnering with municipalities, communities, Doctors Nova Scotia, Department of Health and Wellness, and I'm sure I'm forgetting some other very key people. So as we try to increase physician recruitment, retention, and the incorporation of the clinical strategies into the rest of the operational team, who also have excellent clinical lens to provide as well. Specifically for Shelburne, we have had some success with recruitment and of physicians in this area. Retention is where we need your help. We need to absolutely focus on integration of physicians into the community wherever possible, and we all play a role in making people feel welcome, and I think we would look to you to help us with that. And I'm going to be brief and pass things over to Allison and say thank you.
Good evening, everybody. I'm Allison Lamb. I'm the Executive Director of Acute Health Services in the Western Zone. So my primary responsibilities are the regional sites, so Yarmouth Regional and South Shore Regional and Valley Regional. But I work very closely with my colleagues here in the services that we provide in the regional sites and ensuring that everyone in our zone has access to those in a timely fashion. So we're really focused on ensuring stabilizing staffing within our regionals, but also how do we share those resources? How do we use technology to allow patients to stay in their community and access those resources in the regional centers? So we've been doing a lot of work around that, in addition to increasing our peri-op services, so ensuring that in our regional sites we have those operating rooms running as efficiently as we can to ensure that the people in Western Zone can access that care, and also working with our partners in EHS, how we move patients efficiently between our communities to where they need care and then back home to ensure that they can recover at home close to their family and friends. So certainly lots of work in the zone, and it's really great to see everybody here tonight to listen to your suggestions and your concerns. I'm going to pass it on to Darlene.
Thanks. Good evening, everyone. I'm Darlene Davis. I'm a registered nurse, and I'm interim executive director for rural and community health. Can everybody hear me? And so I work with my fellow colleagues here around planning operational leadership for the rural sites. And you know, all of our rural sites have very unique challenges, and so I work very closely with Jody Ibarra on issues that face the community here, and how do we best optimize care with the resources that we have. So you'll hear a lot tonight about retention and recruitment, and really we're focused on trying to increase your access to care with the resources that we have. So thanks, everybody. Yep.
Can you hear me now? I first want to say thank you everyone for coming out tonight. It's great to see such a wonderful representation from our community, and there are a number of people here that I work with on a regular basis, so it's nice to see you all here. My name is Jody Barra, and I'm the Health Services Manager and Site Lead at Roseway Hospital. And I'm looking very forward to all of your active participation, to hear what is on your mind, to see what we can do to help our community as a whole. As we know, a lot of the focus recently is on ED closures. Although there's some improvement in that recently, we still have a way to go, and a lot of that hinges on recruitment. So our nursing staff challenges have improved, so we're not seeing as many closures as a result of nursing now, but we still have a lot of physician gaps, which is creating the closures. Part of that is all of our shifts are covered by locum physicians, so none of them live local. And so we're in competition, if you will, with other facilities. So these are physicians that work a number of other facilities or have their own practice elsewhere, and they all travel to get here. And we are very fortunate to have the ones that we do have. We have a lot of great resources that come to service our community. So I will pass on to Joanne Wenzel, who is the Director of Primary Care.
Thanks, Jody. Thanks, everyone, for being here tonight. I just wanted to mention a couple things, and I know we work closely with folks at the community, with the community stakeholders, but my job is to support family practice teams across the zones. So I get a really great opportunity to meet a lot of different collaborative family practice teams and help support them. We're really focused on strengthening, growing to meet community needs, and then the piece around recruitment and retention is so important. So a little bit about the team in Shelburne right now, and it's really, we really feel really pleased when we talk about the team in Shelburne. We have 4 nurse practitioners, one who spends a lot of time in the Barrington community. Our positions are filled for nurse practitioners. It's really nice. Our 3 family physicians, we have FPN ×2. I'm looking at Michelle to make sure that I don't mess that up, and an LPN resource, as well as our strong clerical team. We also are a little unique in Shelburne, which I really like. Our diabetes center is co-located with our family practice team. So that really, we try to really create that opportunity for that one-stop shopping approach for folks who might need to meet that diabetes team as well and work with their family practice team. So just a little bit about the team. We're really fortunate, and I think when we think about retention, the Nurse Practitioner Incentive Program is a really great support for nurse practitioner students that are going through the program and want to come back to rural Nova Scotia, often their hometowns, to provide support for their community. So we will have another nurse practitioner join us in the spring through that program, and we're really excited about that. I haven't met her in person. I've only talked to her a little bit on the phone, so we're super excited about that. And the only other thing really important, Michelle is here, Noelle from Virtual Care Nova Scotia, and just to take a chance to drop by and meet her if you have any questions about virtual care and how to sign up. The unique feature about Virtual Care Nova Scotia in this province is it's a wraparound service. So if you have a virtual appointment with a nurse practitioner or family physician on the Virtual Care Nova Scotia program, and through that assessment and care plan, you find that you need that extra step in being seen in person, the team in Shelburne facilitates that. So you would get that, I call it the wraparound service, right? You start to get your needs met on virtual care. We realize you need another step in your care plan, and then there's an opportunity for that wraparound service with the team. So thanks very much, and I'm really looking forward to hearing everyone's thoughts and suggestions as well.
So we do want to acknowledge, we're up in front of you speaking about the initiatives, but there are a number of colleagues from Nova Scotia Health in the room, and it's really important that we acknowledge them. So We do have Michelle, who has really traveled the road completely across the zone with us. Again, as Joanne has said, she is our virtual care expert. If you've struggled at home, if your internet's not great, if you need help, Michelle is your gal. She's with another Michelle from primary health care. We have colleagues from mental health and addictions, as well as continuing care. So if you have questions about community care and how to access community care, they are here to help you. And if they don't have the answer tonight, they'll take your name and number and they will follow up with you and or a loved one. We also have our EHS colleagues from the Department of Health and Wellness and EMCI here. We work in really close partnership. We need to work together to ensure patients get to the right place in the right time. And we do have our colleague from Department of Health and Wellness from pharmacy services as well. We're really working hard at ensuring that all of the professionals in the system are working to full scope of practice. We work incredibly closely together. I've been in healthcare for 20 years. We've never worked more closely than we currently have. So you will see us interact. You will see us defer to one another to answer the questions that you have tonight. So thank you. We look forward to the discussion.
I just also want to acknowledge Kevin McMullen is here tonight as well. We were calling out some of our colleagues, and Kevin McMullen is the business manager for Paramedics Union. I don't know where he is, but he's here. So I don't want to, I talked to him. So I don't want to overlook him, so that you'll know that there's a whole bunch of folks here to support and answer questions and you know, kind of validate what we're going to tell you tonight. So it's good.
Okay, so we're going to start with our question portion, and I just want to kind of do a couple of, I already talked about the pointing thing that I'm going to have to do. The other thing that I'm going to ask is that if you have a question, that's awesome. We'd ask you to have one question. We've done a lot of these, if it's been mentioned, and so we learn along the way that there are a lot of, what we want to do is cover as much ground as we can. So if each person has one question, and then we can move on to someone else, that would be really great. I'd also ask if someone has already asked your question or a very similar question, if you could hold on your question, because that, again, it tends to take away from the breadth of what we have the opportunity, or what we, as a group, what we have the opportunity to learn from each other and from the leadership team. So those are kind of my two asks, if that's, if I can kind of, you can tell I was a facilitator, right? I look for nods of heads to make sure that it's all okay. So if we could do that, that would be really helpful. And again, we'll put our hands up, we'll ask the questions. If we run out of time, which tends to happen, sometimes it's really quiet in the beginning and all of a sudden 10 million hands go up and I'm trying to count and it's not always pretty. If we run out of time, please write your name on your card if you have a question, and someone, and a contact, so your name, email, phone number, someone will get back to you with an answer. So you will have an answer to your question, but I would ask you, so just, I give the advance warning, so if when we cut it off at the end of the night, no one feels like their voice hasn't had a chance to be heard, you will get someone to call you back or get back to you. So we have a bunch of submitted questions too. So some people wrote some questions ahead of time, some people wrote them on cards. I'm actually going to start with a written submitted question, and then I'm going to go to the audience, and our runners are here and here with the mic, so I'm going to be pointing to them and to the question askers, I guess. So first question I'm going to read is a submitted one, and it's timely because this last part of the information was about paramedics. So this question says, last year I read in the news that the paramedic union said they were short 300 plus paramedics. I would like to know what that number is currently. Is it better or is it worse?
So I don't have that number off the top of my head, so I don't know if Jeff or, yep, oh, there's someone down there that's going to answer your question, and we can give you a little update on some other things that are happening around paramedicine as well, you know, as we go along.
Hello. No, we're good. We're working. So the number of paramedics is very fluid. It goes up and down. So I'm Jeff Fraser. I'm Executive Director for EHS, who would oversee the Office of the Regulator. EMCI, who are also here, are our partner in service delivery. So the number itself is fluid. It goes up and down. There are paramedics that are on leaves who come back from leaves. There are new paramedics that go out on leaves. So there's no fixed number, so to speak. But you'll notice from today's announcement that we're very serious about bringing more paramedics into our system. So our last year has been spent on separating out our service lines a little bit. So the EHS system in Nova Scotia was built to fulfill all those mandates, patient transfers in between facilities, people to go to appointments, etc. Now we find ourselves in a spot where we're realizing that we don't need to do that. And so we've created these other roles called clinical transfer operators on the road. What that does is it actually frees up capacity for our paramedics in our communities. And so today's announcement, we do need more paramedics. We are short. And we know now what we didn't know prior to a pandemic and the fragility that goes around that. So our goal will be, so for me to give everybody a number of the medics that we would need over the next couple of years will change as time goes on. As our success continues with our clinical transfer operator program, and as we bring paramedics in, we will be looking for other ways that we can partner with the health authority and others in the service delivery piece within our community. So the number could be 150 today, could be 170 tomorrow, could be 130 the day after, so it does change. We've had some movement as we've had some paramedics come back from leaves in the last year. So before the night's over, I'll get the most accurate number and share that. How would that be?
Yeah, that'd be great. Just to kind of give you an update on the announcement. So to Jeff's point, we know that there is a gap in the workforce, not just all healthcare workers. So we announced today that we will be expanding the paramedic courses. So there will be one offered in Yarmouth beginning in April, I believe. And the other thing that will happen is there will be some, and Pictou in the fall. So Pictou is the other place. So currently train paramedics in Halifax and Sydney. So today we announced that we're adding a training program in Yarmouth and also one in Pictou. That one will start in April, and we are giving some tuition relief. So people who are currently enrolled and people for the next 5 years who enroll in paramedicine will get $11,500 towards their tuition with a return to service agreement to strengthen that workforce. So the paramedics are part of the workforce, and now we have those drivers, our transport drivers. So the numbers of people that are actually in the system have increased. And when we take those drivers and we do transfers in between hospitals, it frees up our paramedics to respond to emergency calls. So we've separated those. We are one of the last jurisdictions to do that. So we have our emergency response and we have our transfer response, and that's proven to be really effective. And the other thing we announced today is that from the regional site in Yarmouth, we have invested in a second fixed wing aircraft that will allow for transfers between Yarmouth and Halifax. So more timely transfers. So we're all used to life flight. So the helicopter will come when there is an emergency, but we do transfers, particularly for Sydney and Yarmouth, because of the length you are from the tertiary center. And so that fixed wing, that new plane, will come and be an added addition to this area, particularly around Yarmouth, in order to support transfer. And we know statistically what we believe is that that will add another, I think, 108 hours a week of EHS response and having trucks on the ground, because we're using this fixed wing between the two sites in order to support travel. So we do also have a big table that sits, which includes EMCI, Department of Health, the union, the College of Paramedicine, so that we can sit and hear directly from the folks that represent the people in the field about how best to support our EHS colleagues. And we know that there's work to do and that there's gaps in the system, but we're really pleased with the relationship we have and the work that we're doing. There's some other things I could probably go on for a while, but the other thing I want to tell you is we've added 24/7. We have a physician and a registered nurse that works in the medical comms center. You might hear us refer to it as the doc in the box and the nurse in the box. And so what that does is when our paramedic colleagues respond to EHS or to a call, if they need support, there is a physician to support their practice in the field, which is really helpful. There are some things that they can do alone, and then there are some things that they can do with physician oversight. And so really looking at how we create the most access and opportunity. So there has been a number of investments in EHS over the last number of months, and there's more to do, but we're really committed to seeing that through. So.
So as of today, we were at 290. We are down to 148 medics that are out of the workforce with 75 active positions that are posted right now.
Thank you. Okay, so I think we're going to go to questions, and I think, do you have a question? I saw your hand up a little while ago, so we'll start with my pointing.
I heard 6 people tell us that recruitment and retention is incredibly important. I'd like to know what you are doing for retention. We've had so many physicians come to our community and stay for their required 2 years, and they're gone again. Why can't we offer good enough incentives to keep them here? It can't be that difficult, can it? I mean, why not pay their med school fees? Surely to goodness, the cost of that would far offset the cost to our health, preventing people from having chronic illness, preventing people from having to, use emergency services. I just don't understand how it can be that difficult. Because a lot of times for physicians, it's about, I guess, the money. They come out of school with huge bills. It seems fairly simple. Maybe I'm missing something really huge, but I would love to know what we are doing for retention.
Sure. So this past year, in September of 2021, the government created the Office of Healthcare Professional Recruitment. And the office works very closely with the Nova Scotia Health Authority and other partners on both recruitment and retention. And one of the things they looked at, in fact, early on was incentives. And last fall, I think it was, the incentive program changed. And for rural physicians, it is $100,000 is what the incentive is for a 5-year return of service agreement. Right, with the $25,000 upfront is how it works, and then there's a 5-year return of service on that agreement. So we previously used to have a number of different programs that did relate to tuition relief and a few other different things, but the new program adds it all into one, so that it was a lot easier, because we heard a lot from physicians that they weren't sure exactly what they could apply for. Sometimes they could stack them, sometimes they couldn't. So we just created a simple program of one particular incentive. I think the other thing that some folks have spoken about is we also know that when we recruit physicians to a community, we don't just recruit the physician, we recruit their family. And so it is very important when a new family and the physician comes to a community that they are really made to feel welcome. And so there's a lot of things that we can do, but there's so many more things that you as a community can do. So we just would really encourage you that you think about that. If you see the person in the grocery store, or if you know that their spouse is working with you, that you do really work hard to make them feel comfortable and welcome in the community, because we know that is really what ultimately makes them stay, that the incentives and pay and things like that are always important, but it's community involvement and engagement that really makes them stay.
I'd also add that there is also a variety now of ways that you can practice in Nova Scotia. So the payment models, as an example, are really, in a way, at the physician's choice. So the physicians that probably many of us are accustomed, I grew up in a rural community in Cape Breton, and so we had the same doctor from the time we were, I think he delivered my mother and he delivered me, and I don't know who else. Like, he's just been there forever. And so those were the fee-for-service physicians that we saw. They staffed our doctor's offices, they staffed our emergency rooms, they were, they did a little bit of everything. And so those physicians are a bit different than our newer physicians who work in a different practice environment. So if you come to Nova Scotia as a general practitioner, you can have a fee-for-service, so you get paid by the person that you see them. You can also work on salary, and so based on, we decide how many patients that you need and the acuity of your patients, like if you have a lot of complex patients, et cetera. So we pay you a salary, and you give us hours of work as a result of that salary. And now we're working on a blended capitation model. So you can work on a salary, and then based on the services you offer at the end of the year, you would actually get a bonus as a result of that. And that's all part of the negotiations with the physician. So there is a lot of practice opportunities here for physicians, and we're hoping the blended capitation will be appealing. We're doing a pilot now. So, and the other thing I'll say to your point about it can't be that hard, it really is that hard, because the world is the oyster now, and what we see is a lot of physicians who, for whatever reason, want to move around and travel. They not necessarily want to lay down roots as quickly as maybe other physicians in the past have wanted to do. They want to try new areas. They want to do some of those things. So we are really competing globally for our physicians. We have also really worked hard with the college to shorten the licensing expectation, or like shorten the bureaucracy, the red tape of it all, to get physicians credentialed more quickly. So there are a number of things that are happening. We have had good luck. We've had 163 physicians, I think, last year, and we're on target to surpass that this year, both specialists and GPs. So we are very fortunate. There are other things that we need to do around work environment and things like that, but we're committed. So I just really encourage you to, you know, and we also have the community fund as well. Okay, so we also have set up a $2 million community fund, and I don't have the list in front of me, but it's about to be announced. So I'm not sure if you have a recruitment committee here, but many communities have a recruitment committee, and they work, often it's with municipalities and through to Department of Health and Nova Scotia Health as a connector. How do you kind of sell your community? How do you bring people in and settle? So the first round of grants has gone out, but we expect that there will be some form of that again to support communities in their recruitment. Maybe it's making a video to sell, you know, the community, or, you know, show your assets, or host you know, meet and greets, or whatever it is the community decides they need. But we want to support the community as well, because you also know best why someone should stay here. Like, you are every one of us is a recruiter, is what I would say, and we can do it together. So that's some of the work that's been happening.
Do you mind if I just add something to that? No, that's okay. So in short, I think everybody in this room knows they don't make John Keeler's anymore. And Dr. Keeler has committed to this community for a very long time, and those are big boots to fill. The piece that I would add, in addition to all of the other initiatives that Minister Thompson has mentioned, is that currently we have, and it's a little bit of a complicated process to explain, but there's what's called a CARMS match. It's a Canadian Association of Residency Matching Service. And what we have created within Nova Scotia is a stream where individuals who have chosen to do their medical school training elsewhere will actually have a stream to return to Canada, to Nova Scotia, to do their training in family medicine. They will have a return of service associated with that, and there will be a defined area in which they will practice. So the initiative that you're referring to, I'm not sure who the lady was that spoke, but that, I think, speaks to the question that you have with respect to how can we be creative around bringing people home. We want to bring people home, because we know that you generally, if you're committed to a community, that's where you'll stay.
I could add, but I'll save it.
Okay. Okay, we got hands up all over the place now. So okay, this is always the fun part. So I'm just going to say, right here? Yeah. I feel like we're doing lottery. And then, yeah.
Thank you. First of all, I moved to Nova Scotia just about 3 years ago, and I've lived in various other provinces in the country, and this is an incredible place to live. I love it here. That being said, I come with a wealth of experience, having worked for provincial governments in other provinces and in other systems, and I have worked in bureaucracies, and I appreciate how difficult it is to work in a bureaucracy. I have a background in education, social work, healthcare, all over the place, human services, essentially. I am concerned that one of the things we're not doing, we're in a very rural area here. We're, in a sense, quite isolated from the rest of the province. To bring people in is one thing, and to retain them is one thing, and it's a wonderful place to be. I'm completely committed to living in this part of Nova Scotia. And my spouse is actually going to school down the road in Yarmouth, doing a BSc in nursing. That's how committed we are in looking at perhaps studying medicine and working in this community long term. But there are at least 4 other young women that I know who are mothers from this area who are currently struggling because the funding isn't there. I mean, the price of gas and so on. Their husbands are fishers. They have to arrange for childcare and so on. And now the price of gas to make it down the highway to Yarmouth. We need to do something about funding, because these are the people who are going to stay in this community. They're generations of background in this community. Their families, their husbands, their children, all of that are here. They're not going anywhere. They're the homegrown product. We've got young people who would like to study medicine. We need to get our schools, our STEM programs. For people who don't know what STEM is, it's science and technology education. We need to get that up and going in this province. And I think that also contributes to helping doctors and so on stay. Because if you have a family, you want your children to be well educated. We have wonderful teachers. The school is doing the best they can, but there's a lot of programs that can't happen because they only get so many dollars. And they have to, there's no fine arts programs to speak of and so on. And those are important enrichment activities. And those are things that medical professionals and other professionals look at. And we need to do something to attract that. Nova Scotia student funding is doing again. They addressed it last year. It's come up again. This summer, 22.5 credit courses are being paid for 15 credits through Nova Scotia student loans. People are freaked out because their funding is not enough to cover their education. I know that the Premier met with the nurses union, student nurses union, DUNS, Dalhousie Union of Nursing Students, that's what it is, and had that reevaluated and looked at. I would really encourage Minister Nolan for you to contact the Premier and say, Nova Scotia Student Loans needs to fund the Dalhousie nursing students fully, because they're not able to go to school. As it is, there's many who are leaving their families and living at the residence in Yarmouth because they can't afford to drive every day to Yarmouth. And so there's little kids without mums and dads. There's families who the moms aren't around, the dads are fishing, and so they're being kept by relatives and so on. If we are a wonderful province that looks after families, we are a wonderful province that looks after communities. They need the support to be able to do that. Thank you.
What an excellent comment. Thank you so much. You will get no argument from us and everything that we can do to help. So thank you.
Thank you. Actually, I think the next question was right up here. And then, sorry, I'm looking this way, and so I've got to switch this way too. So yeah, so we'll have you and then the red.
Thank you very much. I've noticed two people that talk about welcoming the communities, need to welcome physicians and nurses coming in. How do we know who they are if we don't have a doctor and we, don't see anybody in the hospital? Where are these new people? How would we recognize them? I have a cottage that I am more than happy to put up a physician or a nurse practitioner. It's right there. It's ready to roll. Where am I going to find that person? I would love to, if, we talk about the community needs to, but who's organizing the community?
Well, one guy's sitting in front of you.
Well, no, I don't think Nolan is actually. I think it's more local, because Nolan has a bigger responsibilities than just, planning a welcome party or something. Yeah. Who's doing that?
Yeah, that's a good question. Is there a recruitment team here locally? Do you know?
Yes, that's what I was thinking. Yeah, no, I think that's
It's
a really...
Now, I've heard
So,
it's an
Tanya, if you know, do you
information-only
know?
committee.
Well, okay, come on up here and talk about it.
What's that?
Jody. Oh, for God's sake,
They won't let anybody say anything.
give Jody a mic.
They don't have to. They don't do anything.
So we do have a recruitment and retention committee, and it now reports through to the community stakeholder group that we have local. And so there's a number of individuals in this room that sit on our recruitment committee, actually. Penny Smith, Norm, Barb, Henderson Townsend is up there. Val, Kane, sitting here, and Robin Smith will also be on that soon. So,
But what does that committee? What does that committee put out to the public? Like what's going on with that committee that the public would know about so they could support the committee? Pardon me? I said we're trying to get that communication. Yeah, because there's the internet, there's Shelburne Facebook pages, there's, you know, where's the information?
Yeah, so what I would say is we have, actually Fraser, who's helping with the mic, is part of our communications team for Western Zone, and we're looking at getting the newsletter started again that we used to publish. Of course, with everything COVID, it affected a lot of things, and that was one of the things that got set aside, unfortunately, to focus on COVID communications. But we're looking at that, and then what happens is the municipality in their communication will also send out highlights, and so that's one of the ways that we can communicate.
But what I'm hearing is that the community needs to support these people, but there's nothing I've ever seen communicated as to who we need to support in the grocery store.
Yeah. No, yeah, that's a good
and
point.
this has been a long-term problem here for years. So
the other thing that happens is primary health care also does, has a Facebook page. I'm looking at Angie because she can help out. But they will put pictures or photos of the new people joining the practice. So that's on their Facebook page. So there's that as well.
And I think those things are wonderful, but for people coming in who are new that don't know the community well enough, we don't have any way of knowing those things exist unless they're published in a paper.
Yes, absolutely. And your point is well taken. And we do know that we have to strengthen our communications, and that's been a conversation at our community stakeholder group the last few meetings, actually.
Yeah, so maybe you two could connect.
I was just going to say, I would be happy for anybody that has an interest or has questions to reach out to me directly.
I'd say you have a new committee member if I was guessing. If you play your cards right, you might
That's
have a new committee member. Sorry. It's like being voluntold around here. Yeah.
Okay, we have...
I'm getting your name and number now.
Okay, get name and numbers. Okay, this is like the best question and answer yet. We're getting people inside the community talking to each other. It's fantastic about it.
I'll try to make this brief. In 2006, healthcare jobs were hard to get. My son's an ACP paramedic. He worked casual for 2 years before he could get a full-time position. And he worked from Chester to Yarmouth in order to make ends meet before he was actually hired. Now, currently, Shelburne County is 50% unstaffed for paramedics. That's half the trucks have no crew. So 50% of vacancies for paramedics in Shelburne County, that in the 3 bases in Shelburne County, is significant. To this lady's point about helping those in healthcare, I spoke to a lady this morning whose daughter is an ultrasound technician, and she works casual shift. And she's constantly being asked by her staff, why don't you take a full-time position? And this lady told me, because if I take a full-time position, I have to be on call. And I have small children, and my husband works, and I can't commit to being on call. So my suggestion would be, why aren't we utilizing these people for full-time positions and using our casuals to do the on-call, instead of using your full-time people and forcing them to do on-call basis? It's just a suggestion. Here in Shelburne County, cutbacks have stripped Roseway Hospital of almost all of its services. Everything has been moved to the regional hospitals, which we all know has created a bottleneck for tests, minor surgical procedures, emergency services, et cetera, et cetera. We have a brand new medical center, but you can't get an appointment there. When you call, the recording says we're not currently taking appointments. We have no walk-in clinic. Shelburne is over an hour away from Yarmouth and over an hour away from Bridgewater. Roseway Hospital should be a regional hospital. Offload delays at regional hospitals clearly point to overburdened conditions. Moving paramedics to the hospital solves one problem, but it creates another because now we have more trucks offline. So we're basically robbing Peter to pay Paul. If Roseway Hospital can't be deemed a regional hospital, then we need to start bringing services back to Roseway to alleviate some of the overburden at the regional hospitals. We have 2 full wings at Roseway that aren't being utilized. Utilizing those would reduce the wait times, and we could focus more on preventative medicine. We could look at things like either more inpatient beds, because we know that there's a critical shortage of inpatient beds, ultrasound, CT scans, mammograms or women's health, mental health and addiction services, internal medicine like scopes and colonoscopies, chemotherapy. We could have a cancer center here on the western end of the province. Cataract surgery, which is now backed up and has been spoken to in the media about trying to alleviate cataract surgery. We have the facility, we just don't have the services here on this end of the province. An hour and a half, whether it be by ambulance or car, to go for testing or for a medical emergency isn't acceptable, really. And these people that live in Shelburne County deserve the same level of care as people that live in Halifax or live near a regional center. And I'm sure you all realize on your travel from Yarmouth to Shelburne today just how far that really is. So I really don't have a question other than making those points. I would like to know if there's a plan for Roseway Hospital. I think our medical center should be a walk-in clinic. That's a service that we need here. One second, I lost my notes. I also feel that it's time that we think Nova Scotia first, train and employ our children, because our children will want to stay here. Target middle schools, because those are the ones that are picking their courses, and get them interested in healthcare. Explain that there are jobs available in healthcare, and then they'll take the proper courses they need. Doctors and nurses need more seats. We need more schools for paramedics. Great to hear the announcement today. That's fabulous, because graduating classes are small. About 50% of paramedic classes actually graduate. We need permanent distance programs in the tri-counties to allow for license upgrades. So we need PCPs to be able to become ACPs. We need ACPs to be able to become PAs. And we heard the announcement about involving PAs. So I would be interested to know, are you going to offer a PA course here in Nova Scotia, or are our paramedics going to have to travel to Ontario in order to get that? Because then we're in the same situation. Who can afford to do that? Our RNs should be able to upgrade to NPs, and our LPNs to RNs. So we need those services in this area. With the cost of housing, people just can't afford to go and spend time, rent an apartment in Halifax, if you can even get one, on top of rising tuition costs. And lastly, hopefully there's going to be some movement in trying to bring our paramedics that have gone out west or to other provinces, because there's better pay, because there's signing bonuses, because there's incentives for them to go away from home, bring them home. We calculate there's about 300 paramedics that we could bring back to Nova Scotia that would fill a lot of these gaps. Thank you for your time.
I might just comment on a couple of the points there. That was a bit of a book, and you could be in the car with us, because every point that you made, I'm sorry I can't see past that cameraman, thank you, but every point you made, you might as well be sitting in the car with us, because these are the things that we talk about constantly, every day, all the time. So let me just do a little bit of a broad brush. Most of the points that you made refer to people. And you know, that's our challenge provincially, and so we have just a major focus on people from and across the spectrum. And you know, many of the items of which you speak deal with scope of practice and having the right person do the right thing. So ladders to train, so you're a CCA to an LPN to an RN, all of these things, yes. So there are many ladders, there's many bridges. You know, it's complicated. It's like a big bowl of spaghetti. So half of our challenge is to make it simple so that people understand. The point on the middle school, I hugely agree. You know, as challenging as healthcare is, it's also where the action is. It's where the tech is. It's where the future is in so many different ways. And if we could galvanize our junior high and our high school students and open the door and show them how exciting, and there's so many different kinds of jobs within healthcare. And we talk so much about, you know, physicians and nurses and pharmacists and so forth, but it covers the gamut. I mean, it's all there. There's data analysts, there's industrial engineers, I mean, you name it, we have it. And so we have 26,000 people in the province that work for Nova Scotia Health. It's the largest employer in the province. And that's going to continue. So if we don't find ways to employ Nova Scotians, then shame on us. So that's where we're coming from. Okay, so we would not disagree with what you say. The challenge is just make it happen quickly. And so that's pretty much what we're trying to do. I mean, you had so much in there. The schooling and the cost, so this is two people now who have made that point. We can probably dig into that a little bit more. You know, if it's like short-term pain for long-term gain, right? The cost of helping out is nothing compared to keeping a nurse or a medical lab tech or a PA or whatever it is in the community. And the points have already been made that people who are from a community and their families in a community are more apt to stay in that community, and that's the fact of it. That is the fact of it. So, you know, finding ways to make that happen is really important to us. So I'll just leave it at that. We agree, and you know, I could go offline and talk about specifics on each one, but I'll just kind of leave it there. I don't know if you wanted to add anything, but we wholeheartedly agree. We really got to focus on the people. At the end of the day, it's all about the people. And the Roseway Hospital. Yes. Oh, okay. Oh, and the hospital. Sorry, you're right. I'm sorry. That was so far at the beginning of the question, I almost forgot. And the Roseway Hospital. So I don't remember which month, but we were here in the summer, I think, the three of us, and had a tour of Roseway. And I remember very specifically that Jody encouraged, I think it was 1 or 2 nurses to stay on a little bit extra to make sure that the ER stayed open that day so we could see it. Okay? So I first of all really appreciated the fact that she made the effort, but secondly, you know, we talked to all the nurses, we talked to the doctor, was a locum, And, you know, they shared their challenge, and so I recall that very specifically. The hospital itself is beautiful. The town is beautiful. So with the natural attributes, it's just finding the right niche. Now, could it do this or this or this or this? These are questions, and you know, there are some, I'll say, plans, but I think what will come next is a very, let's call it vigorous community discussion so that people can weigh in, and we can do this and we can do that, and you know, what do we really want to, well, you're looking quizzically at me, but what I'm saying is, if the trick would be to be a center of excellence for something. So if it's cancer care, if it's cataract surgery, if it's whatever, so that you can pick a strength and really start to build and play to it. So, you know, I'm not going to sit here and say do this or do that, because I think that's part of a discussion with the community. And so we've agreed, as soon as we got out from under COVID, that most of these community discussions would be taking place. So I would say that will be in fairly short order. So the point was about services and bringing services back. Point taken. I don't know what they are at this moment in time, but you know, I think that's all on the table, and I think a good part of it comes from discussion with the community.
Okay, thank you. Okay, so I know gentleman with the woman behind you trying to be, so I think she's next, and then I know there was somebody over here, okay.
I'm Ruth Waters, and I've worked as a registered nurse in Nova Scotia in Shelburne for 47 years. I'm retired now. I have a whole list of things I'd like to say, but I'd like to just speak to the retention and the fact that, yes, we need to keep our local people coming and working. I don't know if anyone realizes, but Dalhousie, if you apply to Dalhousie, you write something called an MCAT, and that is a North American-wide exam that lets you know whether you can get into med school. If you are between 95 and 100 percentile, which is amazing, you automatically get into Dal. If you make between 90 and 95, out of province and out of country are taken first. So I've known many, many people over the years who would be wonderful. They can't get in. Instead of trying to recruit people from other places, could it not be that we actually pay Dalhousie to do Nova Scotian people over 90? And there again, you know, instead of getting people back here, let's keep them here. I would like to also talk about the onboarding process that people go through when they become part of Nova Scotia Health. There are a lot of nurses that work until they can have a full pension, and other people too, X-ray technicians, what have you. They just are tired of being called in, doing 24-hour shifts, whatever. They're still willing to work, but they'd like the opportunity to be able to say, gee, no, I'm tired, I can't do that shift. So a lot of them do come back. They have to be retired, have 2 weeks break of service, and then they're treated as if no one's ever seen them before in the province. Personally, I retired at 65, was going to help with giving immunizations from the pandemic. It took from the end of January to May to get me in here. I have worked nowhere but Nova Scotia. It's absolutely ridiculous. I would never do it again, and I know many people who just say, I'd like to work, but I am not doing that procedure. We've got to look at this. It's when you have somebody who has worked as a medical secretary, receptionist, whatever you want to call it, and in order to work for Nova Scotia Health, they go back to ask her grade 12 marks from 50 years ago, and that's the kind of thing that's happening. It's ridiculous.
That's actually the case, as you say, and I found that out the hard way when we were trying to bring folks back at the Omicron, which was my first taste of it. And I won't get into all the odds and sods. It's fixed.
That's good, because
It's
it was
fixed.
awful.
It was awful. Even our minister's mother had the same experience. So, yes, it's fixed.
Good. I'm glad to hear that. We really do have to look at retention. As someone spoke here, no, they don't make Dr. Keelers anymore. The doctors, the nurses that I first started with, no one's going to do that. We have to look at being able to accommodate young doctors with family who feel that they cannot provide every service they're asked for, so they leave. And we've got to look at accommodating people better. Nurses, doctors, lab techs, whatever. Because we need everybody, and if they can only work so much, then gee, we're glad to have them do that much. Thank you.
Okay, I think that, again, I'm doing my pointing and I'm saying like, yellow plaid shirt.
Yes, I heard CCA was mentioned. There's people coming in from other provinces with other letters behind their names. It's the same thing as CCA. What's being done to allow these people to become CCAs without going through the full school process?
So I'm gonna tell you what I think is. So if you have a certificate, is it specifically CCA that you're asking about specifically? Yes. Yep.
Question. When I moved back home in 2011, and I went to look for a job at the Red Cross. Right now I'm retired, and all I did was work in retirement homes, nursing homes, and empty community. So when I moved home in 2011 and 2012, I went to apply for a job. My initials were healthcare aide. That's what I got in 95. But I was told I need, what is the initial they use? CCA?
It is, yes,
I said I need
care system.
CCA. Well, back then it was going to cost me money, and I said, no, thank you. Like, what's the difference? We all do the same kind of work.
Yeah.
You know, I'm not bathing anybody any different than the CCA or feeding them any different, so I couldn't get a job. And then my husband was laid off. We weren't retired, so we moved. We left Nova Scotia, and we went back to Ontario, where I could work, because they, you know, now the initials don't have. It's like it should be. It should have been grandfathered in, but can I? And right now, what I would like to do, I'm retired. But something to do is I would like to, you know, do respite care, but I don't even know if I can do that because I have my health care aide, not CCA.
Right.
And I do the same thing.
Yeah. So I'll tell you a little bit about what I know. So again, well, it's getting a little bit long now, but about 16 months ago, I left long-term care. So we've done a lot of work around the continuing care assistants. So continuing care assistants are the backbone of our long-term care, our continuing care sector. So if you have a course from another province, what would happen, I believe, is that you could be hired as what would be called a conditional hire, and you have 2 years. So what happens is we have a program called prior learning, recognition of prior learning. So we look at the skills that you have, the course that you took, and we compare it. And so you would be hired for 2 years, and we would support you in getting a couple of modules, whatever it was that you were missing, but that's free of charge. So CCA's got a significant raise in the province about a year ago. The tuition for the program is now waived entirely, and the course materials as well. So we actually can work in a position as what we would call a conditional hire for up to 2 years, and then you can take some of those programs free of charge. The place where you work can't teach it, but they can create opportunities for you. So there is a more streamlined pathway. If you're going to work in a licensed nursing home, if you aren't going to work in a licensed nursing home, then your employer would look at the skills and qualifications you bring from your previous employment and decide whether or not to hire you. So I will say, to encourage folks, when I was working in long-term care, I can't remember, I think it was 2018, I think there was a class size at NSCC in Port Hawkesbury that would take 20 students, and I think or maybe it was more than that. The enrollment was 20 and they graduated 8. And we probably needed, I don't know how many folks. And so because of the waiving of the tuition and because of the CCA pay raise, there's over 1,000 people in the program, in the continuing care assistant program in this province. And so when we look at, you know, one of the reasons why our emergency rooms are so backed up is because there are people who need to be admitted to hospital, but the beds are tied up because we have folks who are waiting for long-term care or community care. And part of the reason that we have that, not only do we not have enough beds, which we're working on, but we also didn't have the workforce. So there were beds that were open, but there wasn't actually people to care for them. So we've done a lot of work in long-term care and continuing care. There's more to do. But I do think, you know, we can chat afterwards around the specifics. I think I still am connected enough to know, but if not, we'll find out a little bit more for you. So good work happening in long-term care and certainly with the continuing care assistants.
Thank you. So this gentleman, yeah, you. Yeah, you. Yeah. Yeah, I think so. Thank you.
I probably don't need a mic. I've never needed a mic.
Oh, you might just because it's on the video.
Okay,
Might yeah, thank you.
Gonna take a minute here. Firstly, thank you for being here tonight. Appreciate you coming to our community. My name's Daniel. I moved to the Shelburne area 15 months ago. Wanted to change life, wanted to live in a beautiful place, and I happened to found Shelburne. So I want to thank you for this time. In preparing for tonight, I've reviewed from minute to minute 12 of the 16 videos that are currently online. I've also reviewed the documentation that you have on your website and went through it in pretty much, I would say, at least 50% detail. To say the least, I'm concerned. I come from a healthcare background. I've had a charity. I've run with different hospitals in the Ontario market. And I'm concerned about what I'm hearing more than what I'm seeing. Based on the information I've seen on your website, 11.7% of Nova Scotians are still seeking primary care. That's up 10% in the last quarter. That's not a good trajectory, right? Even more concerning is some of the answers that I've heard from this panel over those 12 videos that I've watched, and there's some consistency to what is being said. Some of those things are, I don't know. We will look at it. That's a takeaway. I believe that you guys are the leadership and the future of what happens in this community. You should have the answers pretty readily for community sessions like this. There's 62 times in the 12 videos that I watched where those were the answers, that you didn't know the answer at the time, and I'm pretty confident that you probably did, but may not have wanted to answer them in that environment. That's got to stop. That's got to change. We need to be honest. We have, I don't know how many people are in here tonight, but quite a bit of them out. And I would assume that you guys all come with a significant amount of experience, and these questions need to be answered in real time with the people in the room. One of the biggest examples of this was at the Spring Hill meeting, where the team suggested that they didn't know why rumors were being started about closures. Rumors are started for multiple different reasons. Some of that just people want to be negative and approach different things. But for the most part, if there's transparency as to what's going on, those rumors will not start or they will be killed fairly quickly. So I would invite you guys to put out as much information as you possibly can, both on the website that you've developed and also in media announcements and interviews that you are putting on, including the Premier. In Inverness, the minister stated, "We are trying everything." I would love to know what that looks like. Trying everything is a global macro vision, but it's not very specific. The team qualified healthcare providers is a problem. Qualified healthcare professionals are difficult to find. I happen to own a business locally that has accommodations, and some of these traveling nurses have been staying with us now for over a year, and I've had some pretty good conversations with them about some of the struggles they have and why they chose that route. What I would suggest is if we don't know where to find them, I've flown in and out of Toronto several times. Approximately 10% of the people that are running cabs and limos have a medical background. They're right there, they're waiting. All they want to do, all they want to hear is that there's a roadmap that will expedite their opportunities to help people. Because at the end of the day, healthcare professionals, I don't care what anybody says, money's great, they get into it because their heart is in it, they can't say no to not helping, that's what they do. On several occasions, this team has also stated that they're trying to do everything they can. And I believe that full-heartedly. I've also heard that the community involvement and that engagement with the community across the province is very important to all of you. I hope that is true. Yesterday, we heard from the Premier. I don't have the words specifically here as to what he said, but he was basically an all hands on deck, let's get it done, doesn't matter how long it takes, doesn't matter how much money it takes, go like hell, I think is what the comment was. I'm inviting all of us in this room, every single one of us, including you guys, to go like hell, because we all have a responsibility, whether it's retention, whether it's talking to people, whether it's having conversations about how wonderful a community is, we all have a responsibility to make this happen. What I think is really important is also measuring success, which is a big part of what you guys are doing. My question on success would be, who are you guys accountable for? Who are you accountable to? Is it us? Do we have a responsibility to make sure that the things that you guys are suggesting actually happen in a proper timeline? There is not one timeline on the website that you guys are for, not one. There are 6 key points. I don't know what they are, but there are 6 key points that you guys are doing. Not one of them has a timeline to it. Not one. There was a gentleman who spoke at one of the meetings. I don't know his name. I'll put this down because I'm off script anyway. He spoke about his wife going through a cancer situation that was very troubling for him. I'm sure you remember who this person was. There's a few points that he said that I think are important I want to repeat tonight. He said healthcare workers are heroes. I come from healthcare. I ran a MaxVax clinic in Toronto. I don't consider myself a hero, but I consider the people who really help, the doctors, the nurses, the people who've put in the time, they are absolutely heroes, and we have to change how they are treated. And that comes from all of us in the community as well. We have to change how they are treated, 100%. So there's a number of people who want to engage in that process. On January 27, 2022, nearly a year ago, I presented our MLA with a document which clearly stated several creative solutions to the same exact problems that we're discussing here tonight, the same exact problems I saw in the 12 videos that I watched, the same exact problems that I think everybody in this room knows what they are. Can the Minister of Health tonight agree in front of this group to meet with a group of people from this community that have solutions, that have options that I have not seen, so that we can become part of that process with you, help you understand where our situations are specifically to this community, and be involved with that process? Can you tonight in this room agree to meet with us in the short term to make that happen for this community and for us to partner with you? Thank you.
So I never have a problem meeting with folks. I don't make promises that I can't keep. So certainly at that meeting, there may be things that I'm not able to commit to. So I certainly have no problem meeting with folks. I will admit that my schedule is quite busy. I have my own MLA duties as well. So sometimes scheduling it isn't immediate. But you know, I certainly speak to Nolan on a regular basis, and I don't mind meeting with community groups. I meet with folks, my own constituency and other places. So yeah, that's not a problem. It just may not be as immediate as maybe you'd want, but we can look at the timeline. Yeah.
Sorry. Yeah. Oh, you've got 2 mics going to you, I think. Okay. No, it's good. Yeah, right there. And then I think right behind too, right? So, and then, okay, we'll get you after that.
Thank you. I wanted to say thank you to the recruitment people who worked hard to recruit doctors for this area, because I came home to care for my mom, who was sick with Alzheimer's and couldn't get a doctor. And because they worked hard, and I'm sure there's other people in this community as well, they now have a doctor. So thank you for that. Being a senior citizen, it's not easy to get to another community when the ER is closed here, if you're sick. I don't understand, and I would like an answer. There are doctors in Barrington. There are doctors in Shelburne. If you calculate the amount of doctors in this area, I don't understand. If these doctors in Barrington have privileges at this hospital, at Roseway, why are they not working the ER? I don't know. If they do, then why are we closed? Because there's enough doctors to work the ER, you would think. Also, I would like to ask, in this area, whether we want to admit it or not, we have a serious problem with drug and alcohol abuse. People are depressed, and especially behind COVID. When it comes to mental health, is there a culturally sensitive component to mental health in this area? I don't think there is, and that's something that you need to look at because it's important to the health of everybody in this community. Thank you.
Thank you. Dr. Pugh, are you able to speak and answer that emergency room question? You know the physicians better than we do, for sure.
Thank you for your question. Can you hear me? Yes, thank you for your question. So there are a couple of pieces to answer the emergency scope of practice. So one is that there are different types of licensure afforded to some physicians, and the physicians who are currently providing family practice care in Shelburne have a defined license which does not permit them to practice in the emergency department. So it's a part of their license with the College of Physicians and Surgeons of Nova Scotia. So that's one piece. And the second piece is not every physician who's a family physician practices or chooses to practice in an emergency department for various reasons. They may not be comfortable with providing that kind of emergency care. It takes a special, well, first of all, it takes special knowledge to have that scope of practice. And some people just aren't comfortable providing emergency medicine. So it has to do with comfort, training, and licensure.
Thank you. And I think we have the next question was right behind. Yeah, thank you.
Thank you. I have two very specific questions. The first one is, what is being done to help our clinic physicians who are working hospitalist roles and full-time GP in the clinic and who are burning out because of this? And what specifically is being done to prevent current physicians from leaving due to hospital versus clinic obligations? And again, I just want to thank our healthcare workers for always being there to take care of us. Thank you for that.
So Penny, I'm just going to ask you, the question is, what are we doing to improve the working conditions and could you just, I'm sorry.
Yeah, it's more to do around the workload between the hospitalist position and GP practice, yes.
Right. So we actually have recruited another physician to the area. The timeline, Jody, I'm looking at you, March, April? April. So there will be another family physician coming in April. There is actually, when we have been reaching out to surrounding communities for assistance with provision of care in hospital, we've actually had some recent, I won't say luck, but I'll say some goodwill, and some other individuals are actually willing to provide care in the area. So instead of being on a rotation of what was previously 1 in 3, we are now looking at a rotation of 1 in 4 and sometimes 1 in 5. So the work-life balance should be significantly better. And the choice of how much a physician chooses to practice outside of the hospital practice is a very personal choice. So
we encourage people to make wise choices around how much they work. Sometimes there are other factors that will play into their decision, but it is obviously their personal choice how much they work in their clinic. So we often will encourage work-life balance. It's supposed to be about playing hard, working hard, but we also want us to take care of our workforce, and we support people being kind to themselves and their family, because family time's important. So we're getting there. It's a little bit better in the very near future.
Thank you.
I also just want to let you know there's a program at Doctors Nova Scotia. You guys, Dr. Pugh can probably remind me. I think it's called Restoring the Joy in Medicine. And so certainly at that level, provincially, there's some work happening with the Doctors Nova Scotia around supporting peer support and things like that are happening through that association to support physicians as well, to your point around their work-life balance.
And there's also a mentorship program as well that's being introduced for physicians to rely on others for assistance.
Thank you. We have a question here, and then one, and then two, and then around the back. So we have the two in the front here, and then a couple in the back.
Thank you again, Minister, for providing this opportunity and this venue for this community. Following what our warden of the municipality has just asked, I would also like to ask this. It is embracing the concept of the collaborative care model. We've heard, and perhaps you can refresh the audience, that there have been 2 hires of physician assistants. I believe there's one in Bridgewater and there's one elsewhere. So when we think about that collaborative care construct, as it relates to hospital, in order to support our physicians, could we be a pilot project and have some emergency care physician assistants also on board on that team? And a nurse practitioner, you know, they have their specialty areas as well. So if we had a nurse practitioner in emergency care and a physician assistant supporting and making that team stronger, maybe that could help us.
I think maybe that could help you. So yes, I think the plan as announced today, ERs will have, we're putting in NP or a PA across the province, and I would just encourage, just based on some of the questions and comments, if there is a pilot project that can be identified, you will probably not get any pushback from us. We will embrace, encourage. So it's just landing on the right thing that makes sense, that we can do. There's no, we're limited only by our imagination, truly, okay? We have, as I said in my comments earlier today, the funding is there, the expertise is here, and the political will is here. So when you have the 3 ingredients, it's really just what's the right thing. And I just hesitate to tell a community, because I'm not the best person to say what's best for you. You're the best person to say what's needed, what's the top priority. So I would just encourage that and be open to it, very open to it.
I think too, just making sure that you know the options that are available. So there's the Pharmacy Plus model also is something that's been very effective across the province, and so that's where a nurse practitioner and a pharmacist work to their full scope of practice, and that has really, it was a test and try. We did it in 4 or 5 sites. We're actually expanding it to 24 sites. Working with the Pharmacy Association of Nova Scotia, and the feedback has been very, very good. So, there's a number of things. Part of it is, yes, suggesting a pilot, but also having the opportunity to tell you what some of the options might be. Because, we still in some ways work in that old-fashioned scope that we had, even though perhaps our scopes have changed on paper and what have you, and the system is trying to catch up. And so we kind of say, we look after this much when we all work the way we've been working, but when we expand our scopes, it can widen. And sometimes we don't really know what other people can do. Like, I learn a lot through this. What my colleagues did in healthcare when I was at the bedside is very different than what they're able to do now. So I think there's a dialogue that can happen, and sometimes it is hard in rural communities to bring in a new asset, a new skill set. But sometimes it's about leveraging the assets you already have and making sure that we're really looking at the people that you have and the scopes of practice in your community and how we really expand that to the best of our ability. So there's a lot of different things. So, certainly we're open to hearing what might work best and then sharing what's working best in other like-sized communities around the province.
One of the ways that pilots often emerge is through conversations with foundations. Like foundations, they want to do this, or they're thinking this. And we have a really great group at Nova Scotia Health. It's called Research, Innovation, and Discovery. And this is their job, is to kind of land on something that might be a pilot within scope of practice or a different model of care, or maybe it's technology. So you may have heard on the radio today this virtual emerge. Well, that was a pilot that came out of Colchester. You didn't hear today? You did. Okay, so that came out of Colchester, and then that physician and her small little team, they thought it was going to take like 2 years to develop her technology and the pilot. But they worked with our ID team, and it came together very quickly. So there are resources, and so if there's ideas and they need to be explored or worked upon, I mean, we have people, and we can do that. So I find, certainly in my experience, the ideas come from people talking to people. Typically, it's around a need, or a strength, or a gap. And it could come from any different direction, and we're very open to it. Absolutely.
Thank you. Okay, right behind. Yep. Yeah, and then I see, and then you in the back. Oh, okay, and then, okay. Back in the back. Okay, right there. Yeah, this right here first. Sorry. Yes, she's first, and then someone in the back.
Hi, my name is Andrea. I'm the Executive Director at the Black Loyalist Heritage Centre. So I was the location where you were supposed to be held, but we could only hold 100 people, so I'm glad that the venue was brought here. It's a beautiful centre. Please visit. When I was in Ontario, and I recently moved back last year in June, while I was in Ontario, of course, I always kept my friendship here on Facebook with the friends and family here. And the number 2 question besides, is Sobeys open, is the ER open on Facebook? And that's me being in Ontario, reading it and saying, I'm going home. And people are asking if the emergency is open. That's a bit scary to me, but it didn't stop me because I knew I was coming back for a reason. So when I saw that and when I got here, I realized that that is the truth, that the ER is not open, and I've been fortunate enough not to have gone there yet. I've also been fortunate enough to obtain my MSI card, which is fantastic, very quickly, which was great. I thought a doctor came with a card, but no doctor came with a card. So I'm still waiting for a doctor. But the fortunate thing with me is that I have a Ontario Health Protection Card, or OHIP card from Ontario. That allows me to see my doctor for the next year. So they've honored that I can fly back to Ontario if I needed to see a doctor in Ontario. It also allows me to talk to my doctor over the phone. If the people here in this town were to take their MSI card and move it to a doctor in Ontario and let the Ontario doctors get that money, the province would wake up. And they would see that the money that's going somewhere else should be staying here. I'm very fortunate, again, to have that OHIP card, too. And I'm getting a little emotional because I think about my own family, including my own mother, who also passed away 5 years ago from cancer. So that is a big deal to me. The other question I have is, are there any nurse practitioners or doctors here from Shelburne in this room? A nurse practitioner or a doctor that works at Roseway Hospital or at the clinic? You talked about us wanting to meet those people in Sobeys, but if they're not here tonight, I don't know how to meet them in Sobeys. So it's important that they should have been here maybe tonight so that we could have gotten to know them. Just to at least thank them for a fantastic job that they're doing and the workload that they must have. I'd like to say this, my sister is right here beside me and she's gonna get mad at me, but she was a nurse for a long time. And she burned out, I'm sure, in the system, and she retired. And she came back to Shelburne, which is fantastic. That's what we're doing. Nurses are coming back, people in the healthcare industry are coming back, but we're also facing the same situations that everyone else is here. There's gotta be a way to make the system work. And last but not least, the doctors that I know about that are coming here are doctors of a diverse nationality. Where are the opportunities for those people to meet the other people that are also diverse in this community? Let's have that opportunity. I have not met one doctor here in this community. I've been working out at the Loyalist Center for 8 months. Not one of them has stepped out to that center to say hi. No one has brought them out to see me. No one has brought them out to see us. No one has brought them out to understand that their heritage as African doctors are here in this community. They need to know that. They need to see that we exist here, and they need to be told of their own stories as well. So let's just figure this all out, guys, because we have people that are younger here, that are staying here, retaining here, and their marks, whether it's through a test that you do with the province or the high school. Look at the high school. Look at those young students whose numbers and marks are just fantastic, and they're leaving. Why not help them? Why not have a bursary program at the high school to get those young people here that have those marks and have them stay here and come back to this community? That's all I have to say, so thank you for listening.
I would like to just touch on the diversity comment because it's extremely important, and our experience across the province is the more welcoming, the better. And I think the comment's been made several times, and diverse cultures need to be recognized and celebrated, and you have a very unique setup here. So I would ask respectfully that comment really be taken to heart and be acted upon.
Thank you. The question in the back. Yeah, person with his hand up.
Oh, thank you. Hi, I'm a retired ACP. Just a couple of comments, couple of questions. Like, first of all, thank you for coming down here and listening to us. It's nice to be able to hear a voice, hear the minister, and see what you would like to say. Any idea of, there's no physicians in here. Most of us in here have gray hair or colored hair and are of a certain age. One of the things that I think which would be nice to see, because I heard on a soundbite today on CBC radio that there were real, I don't know if it was you, Karen, or not, but it was really nice to see in Yarmouth, 35 people showed up to get their prescription renewed, right? Yeah. What about, you know, I looked today, right, physicians in this county, 9 to 5. What about the people who work 9 to 5? How can they get to see a physician? Well, they go to Roseway Emerge, right, to do it. Would there be an initiative to put to the physicians in the area, you know, how about opening one night a week, right, for a few hours to see if you can get our numbers down? One in Barrington, one in Shelburne, right? And it probably would help, you know, with the numbers that are going to the Emerge, because 9 to 5 doesn't cut it for people. It sure doesn't. We have to think outside the box, right, to do it. Thinking outside the box, EHS did a program with the Department of Health, and they trained up CCPs, critical care paramedics, for the Lifelight program. And I believe it was about last year, Paula, that they graduated, a number of them, that were schooled in-house. Now, why can't we have physician assistants, right, graduate from the CPP program? It would be in-house in the province, right, and we could do it ourselves. Because the critical care paramedic, I mean, it's unbelievable what they can do. when they come on scene. The last part is the safety net. If I call 911, will I get an ambulance? I mean, let's take a look at it. Let's face facts here, people. Amherst, she was a deputy fire chief. She said no to her husband because they're not going to make it. But she waited 7 hours. That's a tragedy, you know, for that family. The safety net that was built is not there anymore. Paramedics are responding to calls from Shelburne to Sackville, Nova Scotia. You know, lights and siren. Tell me that's right. It isn't. It's not what an emergency service should be. Thank you.
Yeah, thank you for your comments. Yeah. So I don't know if anyone from EMCI or Jeff would like to respond around some of the comments. I think you're right. We have world-class paramedics. They are trained. They're the envy really in North America is what I would say and what I've heard. I have to tell you around the physician assistant and the CCP, I would have to look at that. The physician assistant is we've been using them I think for a couple of years, physician assistants with orthopedic surgeries, but it's the first time they've been brought into here, and now so it is new to us, so we have to learn a little bit. So we are going to put some physician assistants initially in Bridgewater and Dartmouth. I think there's more for us to do. Right now the college has been very helpful of physicians and surgeons. They license them and help us with their scope of practice. And so I think there is more work to do. I just don't know how quickly we can turn that around. So it is absolutely a great suggestion that we can look at.
Yes, and if you want Sharp Medical Centers in San Diego, California, they use PAs right from the CPP program. They graduate them up because they know what an emergency is. And to take your statement that you had, that 65% of physicians or physician assistants could look after emergency program, yeah, that would stop our closures at Roseway Hospital. I think that what we should do as a community is push for some PAs here so we don't have closures. As Ann said, we're an hour away.
Yeah, we have to. So I do think it's something that we can look at. I just want to say what I do know about physician assistants is they need to work under the direction of I lost you, your head's down, but that they do have to work under the direction of a physician as an example, so they need to work in collaboration with them. And I'm not, again, sometimes that means you have to be right there with the physician, and sometimes it means that the physician needs to be available. So, you know, we're really excited about introducing that designation to the province, and we're looking forward to seeing how and where we can use that skill set, and also really looking at how we can use nurse practitioners as well. So we are one of the only jurisdictions in the country where nurse practitioners can actually admit to hospital and discharge from hospital. And so that's very enticing to nurse practitioners from other parts of the country who can come here and get licensed, because it does offer an opportunity for them to work in a different environment as autonomous healthcare professionals. So we do have some really positive things that are happening here to support bringing and utilizing different, less traditional, emerging, new, whatever the word is that you want to use, healthcare professionals in our healthcare system to support meeting you know, the needs of our Nova Scotians.
Thank you. And I think there was one other question over here. Actually, yeah, no, I'm sorry. And I think as I look at the time, this will probably be our last question. So I always say no pressure to the last person asking the question. But those of you that have questions, I know I said at the beginning, I'm just going to say again, please write it down on your card with your contact information. So your email address or your phone number, so someone can get back in touch with you. And again, no pressure, but the floor is yours.
Thank you. I just want to ask a question. You
yeah.
Is it on?
It's
on.
hold up.
You had mentioned something a little earlier coming from the first question about the importance of that you put on not only recruiting physicians, but recruiting their families as well. So I'd like to ask, what advice would you give us in retaining physicians who practice here who have not brought their families?
And that's a challenge and opportunity, as the minister says. So I'll just throw my 2 cents worth out there. Clearly when a physician and his or her family is together as a unit, you've got a fighting chance. It's harder if only one person in a family, but so then you have to really make them love it so much that their family does come, and they do come. And we've had situations like that all across the province, where the community is so welcoming and it's so beautiful, or what they love their work so much that they're not going to leave, and their family comes. So I think that is a community issue, to figure out how to unlock that. I don't think there's any particular secret sauce. There are some communities in the province who have excellent programs. So the committee that has been referred to here, the one I know for sure that's really good is in Pictou County, and I'm sorry, I just forget the name of it. Healthy Pictou County, okay? So I would say they are best practices. They've had a lot of experience, especially with return of service physicians. They've had a bit of a rotating door. So they've had to come to grips with that as a community and figure out how do we stop that, and how do we have people stay. So there are some elements. So that would be one group I would encourage you just to touch base with, to learn. And as we've gone around the province, we've tried to mix and match too. If a group has an idea that might work, great, share it, and let's help each other. So I would just start with that, and I can certainly provide that information.
And could I just add as well, if a physician or a nurse or, if they come here and they don't stay, it also doesn't mean you failed, right? So, So what I'll tell you is healthcare workers recruit other healthcare workers. And so if a physician or a nurse practitioner comes here for a period of time, then and they have a great experience, they have classmates that they keep in touch with. And so, we just really need to think about that. So I don't want you also to feel that if someone doesn't stay, that you've done something wrong, right? To the point, we are competing globally for some of these healthcare providers. The other thing we think about too is, there are communities that have locum physicians or transient physicians that come and go. And what's important if you do find yourselves in that position, the days of having a doctor from the day we were born till the day that person retires are probably they're not here anymore. But if we have a health home for you, if we have a place where you always go to seek care, and sometimes you see the doctor, and then sometimes you see the nurse practitioner, or maybe you see the dietitian, and we build a health home around you where there's one record, and you get to see the people you need to see based on the reason that you come. Maybe you need to see a family practice nurse, right? Maybe you have a little person in your life, a baby that needs immunization. Maybe that you don't need to see the physician for that. So a model that we're very interested in, and it's in the early stages in some places, is this health home, so that you always have a ready, responsive, and reliable place to seek care. But the care providers, some of the care providers may come and go. They may, and the more we can give you, so the dream is for all of us to have an app on our phone so that we have our test results and we have our blood work and we have information, so we really are able to go to anyone and say, this is what's going on with me right now. So that's the difference, the changes that we see. And I know technology's scary for some people, but we also underestimate. We talk about seniors all the time. Seniors are pretty darn handy on their iPads and things like that. They've learned to keep in touch, and I think we underestimate them. I, on the other hand, will be a nightmare with my app. And my colleague Jamal will tell you I can barely operate my phone. So I think we're going to really see a change. But I just, I want you to be welcoming, but I also don't want you to feel like you failed. in the event that somebody chooses to leave for family reasons or personal reasons that you really can't influence.
Okay, well, I think that'll conclude our conversation tonight. I just want to say thank you to all of you for coming out tonight. I do have some of the cards that were submitted that we didn't get to read. If you filled one out already, just if you want to come get it and write your contact information on it if we didn't get to read it. I just want to say thank you so much. It was really great to see such a great conversation and engaged community, and really excited to be here in this beautiful part of the province. And thank you to the health leadership team for coming out and answering your questions, and safe travels home. Thank you.